Welcome back. Joining me now is Kimberly Gardner, the clinical director at Intermountain, and Tricia Ayers, primary therapist and former director of social services at Chaudere. Thanks to both of you for being with us.
Thank you. Thank you.
So let's start off by having you tell us a little bit more about yourself and the organizations that you represent. So Kimberly, would you like to start?
Sure. I'm a licensed clinical social worker, LCSW, and a licensed addiction counselor, and I'm clinical director at Intermountain. So in my role, then, I provide clinical oversight to all of the services that we provide and guidance whenever we are developing a new program when there's a new need in Montana. So we have 31 sites around the state. We have 2 residential programs, one here in Helena with a integrated private school and a therapeutic residential center in Kalispell, and 2 mental health programs, clinics, one here in Helena, one in Kalispell. And then locally we provide psychiatric medication management, neuropsychological evaluations, occupational therapy, in-home services for case management and family work, and also school-based services. And we also collaborate with some of the community health clinics around to partner with them to provide some adolescent and child mental health support services in their particular clinics. And last, we have an education wing that helps put on conferences and educational presentations about complex trauma, adverse childhood experiences, and trying to promote healthy communities so that they can be available to take care of kids and families better.
Okay, perfect. So Tricia, can you share with us about yourself and Chaudere?
Sure. I'm a licensed clinical professional counselor, so an LCPC, and I'm also a licensed addictions counselor. And our organization is a nonprofit organization. We were established in 1896 originally as an orphan, a home for orphan children. And then we've evolved into several different things over time. At one point we were a medical facility for treating children with polio. And then we were the first facility in the state of Montana to have a medical genetics department. And just in the last 3 years, we have gone through a lot of changes and evolved to meet the needs of Montana kids. So we utilize a trauma-informed philosophy at Chaudere. Specifically, we use the sanctuary model, and so we are in the process of becoming a sanctuary certified hospital. So we're very excited about that. Our expansion over the last couple of years has allowed us to provide basically every level of care for our kids that we treat. Specifically, we focus on treating Montana kids and Montana families. So right now we have 2 developmentally specific acute units. So we have one wing that treats younger children, and then we have one unit who treats middle school and high school aged students on that acute unit. So those kids are in crisis. So we also have 2 residential treatment units for our kids, one middle school unit and one high school unit. We also have a day treatment program. We have 2 therapeutic group homes. We have a medical genetics department, like I already said, and we also recently opened our outpatient services clinic, which we're really excited about. So we have access to a wide variety of things, such as occupational therapists, speech therapists, medication management, telepsychiatry, and a registered dietitian if we need it too. So we can offer a lot of things.
Perfect. Couple of very comprehensive programs we have here. Okay, so let's get started with the basics of what type of mental and behavioral illnesses do you see as common with kids? And I'm going to ask you that question, Kimberly.
I think first it's really helpful to understand how mental health has evolved over the last decade, and in understanding that mental health, emotional distress, and behavioral health all refer to the same dynamic and the same situation. So sometimes we'll hear emotional distress or mental illness, sometimes we'll hear behavioral health. It's all the same. So what we know is that kids and teens are typically referred after they've had some difficulty managing their mood and their behaviors at home or school, and they're no longer responding very well to adult care and control. And when that presents itself, we have to look back a little bit and see and understand what has actually occurred in this child's experience and how this family has tried to manage it. So often when kids have experienced some intense or chronic complex trauma or something highly stressful or fearful, then they're going to have an experience that we refer to as adverse childhood experiences, or ACEs. And when that is present, then those youngsters or teens will be expressing it behaviorally, because all behavior is purposeful and it's expressed to meet a need. So when we look at those dynamics when youngsters are referred to us, then typically we're going to see a high level of post-traumatic stress disorder and anxiety and depression. And sometimes we'll see some self-harming behaviors such as cutting or eating disorders or substance use. And then there's a number of youngsters that we work with that have not necessarily experienced trauma or difficulties or challenge, but it's more organically based, such as autism or bipolar disorder. So those are the common ones that we see, although there are some unique outliers as well. And our job is to understand what that youngster is trying to express through their behavior and their emotional distress, and then how can we meet that at the level that will heal that the best, while the entire time working with a team and the prescribers.
Okay. All right. Well, I'm going to need to take a break right now, so we'll come back and talk to you a little bit more. Coming up next, we'll talk more with Kimberly and Tricia about the types of treatment and how children get the help and support they need. Stay with us.